Okay, Chapter 2A, uh, Preliminary Health Screening and Risk Classification. So for the ACSM book, it's chapters 2 and 3. I love this section. This section is boring. If you have trouble sleeping, listen to this one. It'll put you right to sleep. This is stuff that's important. You need to know it. You need to learn it, but it's really nothing that's particularly exciting that you have to do here. I mean, I'll do my best to go through it to speak as monotone as possible to increase the boredom effect. But it is kind of dry. Okay, here we go. So the introduction, compared to previous editions, the ACSM has made some changes. Now you don't have previous editions, so you really probably don't care, and I understand that. But they have made some changes. So if you see other people saying, "Hey, well, we didn't have to do it this way," or whatever, it's probably just changed. So what we've tried to do is we've tried to take away some of the barriers to exercise and really figure out, okay, who's at risk and how much is that risk level. So just to go through it quickly, the new version does not include risk factor analysis or risk level classification. It makes recommendations for physician clearance rather than specific recommendations for a medical exam or exercise test. So the physician, especially if you're higher risk, should okay it, or moderate to high risk should okay it, but you don't necessarily have to get a medical exam and exercise test, which people weren't doing anyway. So, it's just kind of consistent with what people are doing. And does not automatically infer individuals with pulmonary disease for medical clearance prior to the initiation of an exercise program. Again, even if you have disease, exercise is beneficial. If you have disease, then the exercise should be moderate and relatively easy, or at least that's definitely the way you want to start. But we don't want to create a barrier for people to say, well, I haven't got medical clearance, so I can't exercise. We want to take that away. And in the new participation health screening process is based on the individual's current level of structured activity, physical activity. So are they doing exercise or not? The presence of major signs or symptoms of cardiovascular disease, metabolic disease, renal disease, pulmonary disease as well, and the desired exercise intensity. So part of it is knowing what are the risk factors and what are the signs and symptoms of various problems. And to a certain extent, you just have to talk to people. You want to make sure if they have a problem that they let you know about the problem. And that's partially, it's your responsibility to ask the individual and to do your due diligence and do the health history screening. But it's also, to a certain extent, up to the individual to tell you. So oftentimes what I recommend for you, when you work at an organization, that organization is going to have pre-made documents that you're just going to use. But if you feel that there's a hole in that document, try to get that document changed if that's possible. But even if that's not possible, and if you just start working at a job, you don't want to start suggesting changes. You just kind of look like a jerk. If that's not possible, you can at least ask some open-ended questions like, are there any health concerns that you have that you feel like you need to that I need to know about? Have you had any health problems that I should know about? And then tell them, if you don't let me know about these health problems and then you thus have a problem, then that we could have prevented it if you just would have told me ahead of time. So to kind of create that relationship, that comfort level between you and the client, as well as and the patient, as well as you need to be responsible, but the individual also bears a certain level of responsibility as well. So major signs and symptoms suggestive of cardiovascular, metabolic, and renal disease. This is your typical chest pain, discomfort, angina in the chest, neck, jaw, arms, or other areas that may result from ischemia. You need to be able to differentiate between ischemic pain, chest pain, versus other types of pain. So if somebody has indigestion, or acid reflux, a gastrointestinal issue, that pain will present itself different than standard angina. Angina usually feels like a crushing pain, feels like an elephant is on your chest, and the pain will radiate, but it's not consistent for individuals. It can radiate to the chest. It can radiate to it'll originate from the chest in most instances, but it can radiate to the neck. It can radiate to the jaw. It can radiate to the arms, especially the left arm. It could go to your back. So it's important to kind of figure out, okay, what is actually going on, or is it kind of a muscle issue? When in doubt, you err on the side of caution. So when in doubt, you send them to a physician. If it looks like they're having an acute bout, so the person comes in, they're like, chest pain, then you definitely want that individual to go to the emergency room and get that checked out. And if it's something else, it's something else. That's fine. But if it was chest pain and was a heart issue and you didn't get it taken care of, then that's a big problem for the individual, and it's also you would bear the liability of that as well, and you don't want to deal with that in your life. So you don't want to deal with that on an emotional level, and then from a career perspective, it could devastate a career as well. So you want to make sure you take the appropriate steps. Shortness of breath at rest or with mild exertion. And with something like shortness of breath and pain and things like that, it might not be heart related, but it could also be something that's equally as problematic from a health perspective. So just because if they have a significant symptom, you get that checked out, no matter what that symptom is, even if it doesn't nicely fall into a box that, oh, this is heart pain, this is digestive or gastrointestinal type pain. If somebody's having pain or somebody's having some sort of significant episode, even if it's just anxiety, you want to get that checked out and taken care of, documented. So dizziness or syncope. Syncope is a loss of consciousness. A lot of times with these things that they list, you need to understand what the term is. I love this one: orthopnea or paroxysmal nocturnal dyspnea. What the hell is that? Well, that's sleep apnea. So if the person is not breathing or while they're sleeping, that's what that's referring. Ankle edema, which is ankle swelling, especially if it's in both ankles. Palpitations or tachycardia. So if the individual feels skip beats, that would be an indication of that. So the individual is not going to know exactly what's going on, but if they've got this episode where they feel, oh yeah, the heart rate is irregular, you can also get a radial pulse. And if the radial pulse, when you do the radial pulse, you should feel the beat, 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 beat on a regular interval. But if it's going beep, 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 if it's not consistent, if it's not regular, that can also be an indication of a problem. You don't know what that problem is, but it's not it's not the correct way the heart should be beating. Intermittent claudication. This is you can have ischemia, or you can have a blocked artery. Oftentimes we talk about it from a cardiovascular or a cardiac perspective. So you have a blocked artery in your heart and you have chest pain, but this would be a blocked artery typically associated with the leg. So if you have atherosclerosis, plaque buildup, if you have it in one part of your body, you probably have it in other parts of your body as well. It's just a matter of where does it manifest itself and create a problem. So the intermittent claudication is when you walk, you have severe leg cramps or leg cramps, you stop, the cramps go away, you start walking again, you start having cramps again. So if somebody has cramps in their leg, their calf, all the time, then that might be something else. But if it's associated with activity, you stop the activity, it goes away, you start the activity, it comes back, that's more of an indication of intermittent claudication. It's an indication that you have plaque buildup in your arteries. And again, if you have plaque buildup in one artery, you have it in other arteries as well. Known heart murmur, unusual fatigue or shortness of breath with usual activities. As I said, isn't this exciting? Uh, this updated pre-participation process is based on outcomes of a scientific roundtable sponsored by ACSM. So they didn't just come upon lightly of changing the recommendations. They thought about it. Experts got together and developed kind of a better way. So the relative risk of a cardiovascular event is transient. It is transiently increased during vigorous intensity exercise as compared with rest, but that the absolute risk of an exercise-related acute cardiac event is low in healthy asymptomatic individuals. So if you go out and exercise, chances that you'll have a heart attack are low. And just think about it logically. I mean, do you know of any of your friends that have had a heart attack? You know, if you think of people that have heart attacks, at what age does that normally happen? What does that person look like? So they're trying to kind of address that. Among adults, the risk of activity-associated cardiac issues is known to be highest among those with underlying cardiovascular disease who are unaccustomed to vigorous physical activity. So there's insufficient evidence to suggest that the presence of cardiovascular disease without underlying disease confers substantial risk of adverse exercise-related cardiovascular events. So again, you know, what the heck are they talking about? You can memorize that, you could spit that back to me, but you need to know what that means on a practical level. And on a practical level, it just means that if you don't have known symptoms, the chances of an adverse event are fairly low. Cardiovascular disease risk factors based on pre-participation health screening may be overly conservative due to the high prevalence of risk factors and may generate excessive physician referrals, particularly in older adults. So a lot of people are going to have risk factors, but they can still exercise. You need to kind of watch the intensity that they have. If I look at myself, my cholesterol is on the borderline of high and would be considered to be high. Then you start looking at my age. You know, you start looking at these things and say, oh, well, he's got more than one risk factor. He should go to a physician to get checked out. And really, my risk of a heart attack is very low. So, you know, you get older individuals, they have blood pressure, their blood pressure is high, their cholesterol is high. They need to get checked by a physician. It's important to have good relationship with a healthcare provider. But from an exercise perspective, seeing that you have risk factors, that things just got overly conservative of going to a physician and before you could exercise. Again, we want to take away the barriers to exercise. So exercise professionals are encouraged to complete a risk factor assessment with their patients as part of their pre-exercise evaluation. They're still recommended to do that, but you don't necessarily keep the person from exercising just because they have risk factors. The health screening, pre-participation health screening before initiating physical activity or an exercise program is a two-stage process. There's the need for medical clearance before initiating or progressing exercise programming, or progressing exercise programming is determined using the updated, revised ACSM screening algorithm, and you'll see the screening algorithm. In the absence of professional assistance, interested individuals may use self-guided methods. So, you know, from a public health perspective, you can kind of do this on your own. You know, and it still helps the person be able to exercise and not put all these barriers of, oh, you have to see a physician. Well, I don't want to go see a physician. I'm too busy to see a physician. You know, I know I definitely fall into that category. I really don't feel like it. So this kind of takes that barrier away. If indicated during screening, medical clearance should be sought from an appropriate healthcare provider. Excuse me. Let me get some water. The manner of clearance should be determined based by clinical judgment and the discretion. Excuse me. The discretion of the healthcare provider. So you need to kind of keep in mind, these healthcare providers don't necessarily exercise. I mean, when you look at a nurse or you look at a physician, how many of them exercise? A lot of them don't. So they're going to look at it from a cardiovascular perspective. They're going to look at it from the perspective of whatever their specialty is, and then kind of take it from there. And generally, they're going to say, yeah, it looks fine. And then you have to use your discretion as well to say, okay, based on the knowledge you know, and you're going to know more about exercise and health effects than necessarily the physician or some physicians are. So kind of keep that in mind. And use your judgment as well. If somebody is approved and you think that they need to be evaluated some more, then there should be further evaluation. If they say, yeah, the person's good to go, and you feel that they're good to go, then they're good to go. So some of the self-guided methods: pre-participation health screening, look at the medical history, the risk appraisal, and it should be done by individuals wishing to start a program. The program can be easily accomplished by using the Physical Activity Readiness Questionnaire Plus. And here it is. So it's expanded from the initial Physical Activity Readiness Questionnaire. So it used to just be these 7 questions that were asked, and now they've kind of expanded it some. They're looking at issues of osteoporosis, arthritis, back issues, cancer, heart-related issues specifically, blood pressure, metabolic conditions. So it's a little bit more sensitive than previously. Mental health issues, respiratory issues, spinal cord injuries, so those that are paraplegic or quadriplegic, if you've had a stroke or any other medical condition. And this is kind of, I mentioned this previously, that you want that open-ended question. Do you have any other medical condition not listed above? Or do you have 2 or more medical conditions? So if you have any other medical condition, the individual needs to let you know. It's just the end of the questionnaire. So the pre-participation screening algorithm, they go through a bunch of they go through an algorithm. So if it's yes, then you do this. If it's no, you do this. And it's used to identify participants for cardiovascular complications during or immediately after exercise. Although resistance training is growing in popularity, current evidence is insufficient regarding cardiovascular complications during resistance training to warrant formal pre-screening recommendations. You think that people would have heart attacks while they do strength training, but generally they don't, or there's really no evidence to suggest that they do. So we don't have these parameters associated with resistance exercise. Again, individuals need to use discretion. I think if you had a lot of novice individuals that are older, obese, have already cardiovascular risk factors, and they started doing high intensity CrossFit type training, I think you're going to see people that would end up with heart attacks. There's no evidence to support that at this point because it's not been reported. There's no studies on it. It hasn't really been evaluated. But if you just use a little bit of thought, a little bit of common sense, you can kind of put 2 and 2 together to say, okay, we should probably take these precautions. So kind of keep that in mind as well. And the good news is that if you want to engage in resistance exercise, you can. So the algorithm components: classifying individuals who do or do not participate in regular exercise, identify individuals with known disease, and identify the desired exercise intensity. And the exercise intensity is huge, because if they just want to do moderate activity, then it makes things easier. And for most of these individuals, if you already have some sort of disease or disability, you're not interested in high intensity exercise. Think about it. Like, think about your parents and aunts and uncles and grandparents. Are they interested in high intensity exercise, especially if they have some level of disease? If they're obese, they're diabetic? Probably not. they probably don't want to do any exercise. So getting them to do any exercise, even moderate exercise, is beneficial. And that's what we want to push them for. So that's kind of the thought process you need to keep in mind there, that generally people are going to be doing moderate types of activity. And you may look at yourself and say, well, I like to do vigorous activity. I like to beat the heck out of myself. And I'm one of those people. I like to beat the heck out of myself. If I'm going to work out, then I want to feel it. But for a lot of individuals, that's not really what they want. They don't like to exercise. So any exercise is kind of takes a little bit of willpower, and it's not easy to start. So anything they do is a step in the right direction, and chances are they're probably not going to do vigorous exercise anyway. So again, use some common sense and be realistic about what the expectations are of how the individual is going to exercise. So this algorithm, I'm not going to test you on it, but if you need it, it's here, and you should make it available to your patient population or clients. And again, if you're working at a facility, the facility is probably already using something. But this is definitely something you can always fall back on. So, medical clearance for moderate intensity, exercise not necessary. And this is known cardiovascular, metabolic, or renal disease, and asymptomatic. So this is a health history screening, or a pre-participation health screening questionnaire. If people are using something else, that's fine. The ACSM is providing this one, and this one can be used. Now, in the ACSM textbook, they have things about the cardiac rehab facility and risk associated with exercise. And if you look at that, and my guess is probably most of you won't, but if you do look at that, what you see is that it's different from the other risk factors. So these are people that are attending a cardiac rehab facility. So you would expect these individuals to have already had some sort of cardiovascular incident. They're definitely older individuals. So you're looking at them having more problems, so to speak. So if you're looking at the general population, they really shouldn't have a lot of these issues. But those things, if you look at them and again, it's there as a reference. I'm not going to ask questions on the test, but it's there as a reference. So kind of keep that in mind. This is more from your book, from the Hayward text. You have the informed consent. They mention the Part Q, medical history questionnaire, lifestyle evaluation. Again, those things are similar to what the ACSM, and again, they're both working together. So they provide it in a slightly different format, but the information is the same. Yeah, we've already discussed this, but I'll read it. The healthier populations typically encountered in the health fitness settings generally warrant a less intensive approach to the pre-exercise evaluation. However, individuals with chronic disease and other health challenges may be encountered in these settings, so exercise professionals are urged to be prudent in identifying those who need medical clearance. And as mentioned before, the ACSM, the edition, the 10th edition, it came out this year. So if they're asymptomatic, they can engage in moderate activity, without any real evaluation, medical evaluation. So kind of keep that in mind as well. If you have somebody that's got major risk factors and has had previous documented disease and they're coming to your facility, that's fine. You can exercise with them. They can exercise, but they should probably keep that activity, at least for now, at the moderate intensity. So components of the informed consent. Anything you do should be thoroughly explained. As with other stuff, you don't want to deal with a loophole. You want to make sure that people understand what's going on. So if they have questions, if they can read, you have the written sheet that you hand them, they read it, and then they sign it if they want to participate. If for some reason you're dealing with an underserved population, or you're dealing with people that can't read, then you should read it to them, and talk them through it. If they have questions, explain whatever their questions are. Give the answers to whatever questions they are, or refer them to somebody that can answer it. Make sure that you just don't want people to be feel like they've been tricked into participation, or tricked into participating in something riskier than it actually is. In the informed consent, you should talk about the purpose and nature of fitness testing, the risks and benefits of the testing, confidentiality, the opportunity to ask questions, and that the participation is voluntary. They can quit anytime. Now, if you're paying them or giving them some sort of reward for participation, if you're getting extra credit points, then if you don't finish the study, then you won't get the extra credit points, or you won't get the money, or whatever. People need to understand that you need to complete the study to get whatever reward you were supposed to get. But people can quit at any time for any reason. And then if the facility has any guidelines, you follow those. So at UTC, we want individuals to complete an IRB, Institutional Review Board forms. You want to make sure that that is completed. Whatever your facility wants, you make sure you abide by those guidelines. This is informed consent for an exercise test. This is one way that they put it together. I've got other informed consents as well, so you can use any of it. And this is the last slide.